Good afternoon. My name is Ed Giesbrecht, and I'm an associate professor here in the Department of Occupational Therapy at the University of Manitoba. And for some context, I am a white man whose grandparents settled in Canada from Russia in the 1920s, along with many other Mennonites at that time. As a virtual event, we may be participating from a variety of geographic locations. As the host of this event, I want to convey my gratitude to live and work on Territory 1, or rather Treaty 1 territory, which is the unceded land of the Anishinaabe, Cree, Oji-Cree, Dakota, Dene, and Métis peoples. I want to acknowledge the historical place of Indigenous peoples as caretakers of this land, for their leadership in the pursuit of reconciliation amongst our peoples in spite of broken promises, and their wisdom as we seek to move forwards in relationship. With respect to this relationship journey, I'm working at humility to learn and better understand when and where I lack perspective in ideas, words, emotions, and structures that impact others, those without the privileges I've been afforded, and the humility to receive this learning. These issues of privilege, I think, are quite relevant to today's Illuminate presentation by Dr. Emma Smith. She will be speaking on the topic of the rights of persons with disabilities and why assistive technology matters. Dr. Smith is a research fellow at the Assisting Living and Learning Institute at Maynooth University in Ireland. I have had the good fortune to become a colleague and friend of Dr. Smith during our PhD studies at the University of British Columbia. Since then, Dr. Smith has been extremely involved in melding her expertise in rehabilitation and assistive technology. She serves on the board of directors at the Rehabilitation Engineering and Assistive Technology Society of North America. She's the chief editor of the Assistive Technology Journal and is actively involved with the World Health Organization Global Cooperation on Assistive Technology Initiative, to name only a few achievements. I could go on about her academic achievements and her extensive volunteer contributions, but I think you'd be more interested in listening to her than me. So without further ado, I will introduce Dr. Emma Smith. And if you have questions, we'll have time for those at the end, or you can put them in the chat and I can present those to Dr. Smith as well. Emma.
Thank you so much, Ed. And I'm thrilled to be here today and thrilled that so many of you are here with us and are looking forward to talking about this really important topic, which is around why assistive technology matters to the rights of people with disabilities. As Ed mentioned, I'm a research fellow at Maynooth University at the Assisting Living and Learning Institute. I am fortunate to have support from the European Commission through Marie Skłodowska-Curie Action Research Fellowship. And today I'm going to talk about my work in general, but more so about where my work fits into the conversation around rights, and also talk a little bit about some of the research that's been done by myself and my colleagues and some of the others in the environment that we're working with that looks at these issues around rights and assistive technology. So without further ado, we'll get started. I did want to just make a few notes at the beginning around accessibility for this presentation. So for those of you who need it or want to use it, we do have automatic captioning turned on, and we can that will produce a transcript of the presentation, which can be prepared. And I'm happy to do that if you need access to it when it's done. As a general statement, I prefer images over text in my presentations, so we'll do my best to make sure I describe images as they appear, but I'll also have an accessible PowerPoint or a PDF of the presentation with alt text available for images if you would like to access it after the presentation. And to access either the transcript or the presentation itself, you can email me at emma.smith@mu.ie, and I'll pop that email up at the end as well. I also just wanted to give a caveat around language and language use. So throughout my presentation today, I'll be using the term person with disability or person with a disability. As a general statement, I ascribe to the social model of disability rather than the medical or deficit model, suggesting that people are disabled by their environments, including the physical, social, or institutional environments they live in. And I acknowledge that the term disabled people is often used within this context in lieu of the term person with a disability. But I have chosen in this case to use person with a disability to acknowledge the diversity of a person with a disability, that they may also be a person with a job or a person with a family. And perhaps more importantly, in this case, that they are a person with rights. This is also aligned with the Convention on the Rights of Persons with Disabilities, where the term persons is used in lieu of people to highlight the individuality of persons rather than a collective or homogeneous experience of disability. I've included a blog post link at the bottom of this slide, and I would be happy to share that with you at the end as well if you wanted it, which informs, it was actually written by my supervisor, but it informs my decisions in terms of language. So I just wanted to make sure that that was discussed. So I'm going to start with my last slide first, and I'm going to come back to this. But to begin with, there are three things that I really want you to walk away with at the end of this presentation. So the first is that persons with disabilities have the same rights as people who currently do not have disabilities. So that's a big statement. There are no different rights. Everybody has the same rights. It's just maybe that in some cases we talk about those rights differently because people have been marginalized or have been historically excluded. In a society that has agreed on those rights, it is then our responsibility to ensure those rights are realized. And I am going to base my conversation from that standpoint today. And then obviously the third point that I think would be obvious from my title, assistive technology is critical to the realization of those rights. And as I said, I will come back to these, but that's what I'm hoping you walk away with today. I did have a few learning objectives that I was asked to put together. So these are more specific, that by the end of the presentation, you should be able to describe in general the relationship between assistive technologies and the UN Convention on the Rights of Persons with Disabilities, to describe the relationship between assistive technologies and the achievement of the Sustainable Development Goals, and to describe how assistive technologies promote access to rights for marginalized or historically excluded populations, including persons with disabilities. I'm going to start by talking a little bit about what rights are and the context in which we discuss rights in our societies. And I will talk about it on a global level, and I will also talk about it on a more direct Canadian level. So first of all, rights are socially agreed principles. They are not something which exist independently of a society or independent of that agreement. But they are those principles that we have as a society agreed are important for individuals to have access to. Those rights are typically enshrined into law, and they are enshrined into international law, and then they are enshrined further into national or local law. Rights are typically protections for individuals or for groups, and they are fundamental to the freedom of those persons. So in the preamble of the Universal Declaration of Human Rights, which was adopted by the UN General Assembly in 1948 following the Second World War, we say that we recognize the inherent dignity of the equal and inalienable rights of all members of the human family in the foundation of freedom, justice, and peace in the world. And there is an image here of the text of the Universal Declaration of Human Rights. And I want to mention that these are not the only rights. So these are the rights that we have agreed to as a society as a whole on an international context. There are many scholars who would argue that there should be additional ones, or that people should be entitled to different things. But these are the ones that are enshrined in international law, and countries like Canada have their own charters or legislation which will define rights further in that country. So in Article 2, and I think this is really important to think about, everyone is entitled to rights and freedoms set forth in the Declaration without distinction of any kind. So that would include race, color, sex, language, religion, political or other opinion, national, social origin, property, birth, or other status. And the other status is important here, as well as that point about distinction, because although persons with disabilities are not mentioned explicitly in the Universal Declaration of Human Rights, they still fit into this definition of everyone who is entitled to those rights and freedoms. So this is just a very quick image of the various rights that are found within the Universal Declaration. And I'm not going to go through them all, but the rights are very broad. They are things like the right to privacy, the right to be seen as innocent until proven guilty, the right to have marriage and a family, not to be subjected to torture or slavery. So very much broad rights on a global level. And all of these rights are applicable to every person, including persons with disabilities, despite the fact that I'm now going to go on to talk more specifically about the UN Convention on the Rights of Persons with Disabilities, which takes these rights a step further. So this image here from Inclusion Europe, they put together a really nice little explainer video, if you ever need one, called "What is the United Nations Convention on the Rights of Persons with Disabilities?" This was a convention developed at the United Nations in the late 20th century with a growing recognition that persons with disabilities were often experiencing circumstances which were not equally experienced by persons without disabilities, and that it was necessary to have specific rights of those persons defined and enshrined in both international and national law. So the UN Convention on the Rights of Persons with Disabilities was a response to this call, and it came into force in 2006. So it not only recognizes that persons with disabilities are entitled to all of the same rights as everyone else in society, so all of those rights from the Universal Declaration, but that persons with disabilities also require additional protections to address discrimination and to enable full participation in society. And that full participation is on par with everybody else. So it's not unique. It is to say, these are additional considerations we need to take to ensure that people have access to full participation. So the purpose of the convention is to promote, protect, and ensure the full and equal enjoyment of all human rights and fundamental freedoms by all persons with disabilities, and to promote respect for their inherent dignity. So I've bolded a few words there. So that concept of full and equal enjoyment of all human rights. So again, it is all the same human rights. We all carry those same rights. We just know that there have been experiences of discrimination that have caused people with disabilities to experience those rights differently, that those fundamental freedoms don't change, and that it really is embedded in this idea of respect for the inherent dignity or worth of a person. They go on to describe what a person with disability is, and they describe that as someone with a long-term physical, mental, intellectual, or sensory impairment. And you'll see here that there is an interaction with the social model of disability, because they describe that as being an interaction with barriers which can hinder their full and effective participation in society on an equal basis with others. So that participation is intended to be equal, but we know that not all situations are equitable. So not everybody gets access to that equal participation. This image is a little old, so it only shows the ratifications of the convention as of 2017, and there have happily been some changes since. And I say that because often with an older convention, like one that's from 2006, you don't necessarily see those changes and those ratifications further down the line. But there have been changes, and so that's exciting. This gives a general picture in this map. It's color coded, and it shows all of the countries in the world. And as of today, the United Nations Convention has been ratified by 184 countries. So ratification, for those of you who aren't fully aware of how this works, ratification means that the convention has been taken by a government and has been enshrined into their law in some way through a legislative action. If you're looking at the colors on the map, you'll notice that there are a few countries who are yellow. Those countries, notably the United States, are signatories to the convention, which means that they have agreed in principle, but they have never enshrined it into law through ratification. Those in blue, which make up about half of the remaining countries, have ratified the convention only, and those in red have ratified the convention and the optional protocol. So there was a section of additional protocols that were put in place that countries could choose to take on or could choose not to, in addition to the general convention. So as I said, ratification means they've accepted this in legislation by their respective governments. And as a consequence, they are therefore enforceable in national law. And people who would like to take charter challenges to it can do so. And I just saw there was a question in the chat that asked if the United Nations has ratified to date. And the question is no, they have not ratified. They are still a signatory only. There's various reasons for that, all of which are political. So the articles of the UNCRPD, there are 50. Articles 1 to 4 are generic purpose, definitions, and general principles and obligations. Articles 5 to 30, where I'm going to put a little more focus, are on the specific rights of individuals. 31 to 33 are around gathering statistics, how the rights are, or how the convention's implemented, international cooperation and monitoring. Articles 35 and 36 are about reporting, so how we report on the obligations to this convention. And then Articles 37 through 50, which is quite a huge number, are very administrative in terms of committees, reports, signature, consents, those kinds of things. So I'm going to focus on Articles 5 to 30, which is the specific rights of individuals. So there's a lot on this page. These are all of the articles from 5 to 30. These are the general titles of the articles. And you can see from this that there is a huge range of different things which are addressed within this convention. So equality and non-discrimination is sort of at the forefront, and it's at the top for a reason. It's Article 5. But then it addresses things like situations of risk in humanitarian law, access to justice, freedom from exploitation, respect for privacy, education and health, access to habilitation and rehabilitation or work and employment, standards of living independently in the community, cultural life and recreation. So these are more directed than the rights that we saw in the Universal Declaration, because these are the areas that were often challenging for people who had disabilities in order to get those rights realized. So these were identified as the key areas that needed to be addressed. So in terms of Canada's commitments to international law and international convention, obviously Canada was one of the countries that signed on to the Universal Declaration of Human Rights very early on in the late 1940s. So Canada actually ratified relatively immediately. But Canada also then adopted a Charter of Rights and Freedoms. And the Charter of Rights and Freedoms was adopted in 1982 and largely stemmed from the Universal Declaration of Human Rights as a baseline, saying that Canada needed to have this properly enshrined into Canadian law as to what the rights of individuals were. The Convention on the Rights of the Child came next, and I'm mentioning some additional ones because I think they're still really relevant, because all of these rights are still applicable to all people. So if it's a child who has a disability, the rights of the child are still applicable to them, in addition to all of the rights that are enshrined in the Declaration of, or in the Convention on the Rights of Persons with Disabilities. So the Convention on the Rights of the Child was brought in 1990, and Canada signed immediately and then ratified in law in 1991. The Declaration, or the Convention on the Rights of Persons with Disabilities, which is the next image over, came into force in 2006 and was ratified in 2010. And the Declaration on the Rights of Indigenous People, again, another document which, if it's an Indigenous person who has a disability, then they are entitled to all of the rights in all of those documents, whether it's the Declaration on the Rights of Indigenous People, the Charter of Rights and Freedoms, the Universal Declaration of Human Rights, or the Convention on the Rights of Persons with Disabilities. So that actually came into effect in 2007, but notably Canada did not actually adopt this until June of 2021. So literally less than a year ago, Canada actually brought this into force in terms of bringing the UNDRIP into law. And I think that's important. And I'm going to come back to that actually when we talk a little bit more later about some of the challenges of marginalized groups. So now I'm going to just jump into the assistive technology side, and I want to talk about definitions at the beginning just to make sure we're all on the same page so that you know what I'm using the language for. So assistive technology broadly is an umbrella term that the WHO uses to cover the systems and services related to the delivery of assistive products and services. So it includes policy, it includes products, it includes services. It's a very broad, overreaching term that's used. The WHO distinguishes assistive products separately, which are those items which maintain or improve an individual's functioning and independence, thereby promoting their well-being. And that's all that information is available on the World Health Organization's website on their assistive technology pages. So this is and I'm sorry, I'm just noticing that there's some cutoff there, but it's an image from the WHO Global Cooperation on Assistive Technology, which is their primary organization that works on the issue of assistive technology. And this is the image which they use as their theoretical framework in a sense. So people are very much at the center. They are the beneficiaries of assistive technology, but they are also at the center of the experience of assistive technology. There are three items around those people, which are the provision systems, the products themselves, and the personnel who deliver them. And they all exist within a policy framework or a policy environment, which ideally, from the WHO's perspective, should be provided within universal health coverage, and is also within the context of the Convention on the Rights of Persons with Disabilities. So it's a lot of concepts in one, but I think they're all really important as overlapping and interconnected concepts to understand the complexity of how assistive technology is used and delivered. So the WHO has used this to inform most of their work since. They call them the 5 Ps, and it has given people a framework within which to discuss. WHO also produced a document a number of years ago called the Priority Assistive Products List. And this was done through consultation with people from every World Health Organization region. Hundreds and hundreds of people participated in this process to identify the 50 products which should be available to every person in the world, regardless of which country they were in. So obviously that's a huge range. When you think about a high income country, and Canada would be included in that, where you probably have access to more than these 50 products, or hopefully have access to more than these 50 products. But it had to be universal. So it had to be able to be used by people in lower income contexts as well as higher income contexts. So these 50 products are addressing all areas of assistive technology need, ranging from braillers to hearing aids to walking sticks to wheelchairs. So it is the 50 products which have been identified as being the most critical for people to have access to in every country through universal health coverage. When we're thinking about those products, and I think often about the assistive product list products because a lot of my work is in lower income contexts. But when we think about those products, as well as all of the others, there are many ways in which those products promote access to rights. So one way in which they do so is by promoting personal dignity and inherent worth. So by allowing somebody to be themselves and to have dignity in their day-to-day lives, and therefore also have that access to that sense of inherent worth. They also provide and support access to critical services. And I'm going to talk a little bit about that in relation to some specific products, just as examples. But access to those critical services is often a way that we promote rights, particularly when we think about services like information that is needed from a health perspective or justice. Access is important. They support participation across all aspects of life. And when you look at the rights in the UN Convention, you'll see that participation is really a key part of the rights that are set forth in the Convention. They allow access to information. And for many, that's part of being able to not only understand their rights, but then to realize their rights. So access to information is critically important. And without assistive technology, often people, particularly those with sensory disabilities, would not have access to. They support access to justice in a variety of ways, whether it's through court systems or through information, and they support personal choice and freedom. So again, really critical to being able to actually realize those rights set forth in the Convention. So this is that list of rights again, just to bring them up. And you'll see that I've brought 4 out in bold: access to justice, living independently and being included in the community, freedom of expression and opinion, and access to information, and participation in cultural life, recreation, leisure, and sport. And I haven't pulled these out because they are more important than any of the others. I just knew that I needed a little bit of focus in terms of the conversation today, and wanted to make sure that I had the opportunity to talk about some in a little bit more depth. So all of them are equally important. I'm just going to talk a little bit more about some of the work that's being done on these 4 in particular, just to give you some examples and show how different types of assistive technology may actually promote access to these rights. I'll start with Article 13, which is access to justice. Article 13 talks about people having access to justice on an equal basis with others. And that's really important, that everybody experience the same access to justice. That means that they have to have accommodations, whether they are procedural or age-related, that are appropriate for their needs. And those accommodations must facilitate their effective role as direct or indirect participants. And that point about direct and indirect participants is important, because it may be that they are the person involved in the legal proceeding, whether it's as somebody who has laid charges, somebody who is responding to charges, or somebody who is a witness. But it may also be that they have a material interest in a case, and they need to also be able to have an effective role in participating as an indirect participant through some kind of legal proceeding. And they must be able to access any legal proceedings, including investigative proceedings and any other of the preliminary stages. So you can imagine that for somebody who has a communication difficulty, as an example, this might be really difficult, especially in all of those different pieces of the legal proceedings. So I put up an article here around access to justice specifically, and it's looking at how a practitioner, in this case a speech and language pathologist, may be able to help a person who has a complex communication need to ensure that they get access to justice on an equal basis with others. So in some cases that might include support, but in many cases it would include assistive technology, and ensuring that the assistive technology someone needs or someone uses on a regular basis is used within the court process or within the legal process, and that there are people within the system trained to be able to use that with them. So for those of you who have worked with people who use speech generating devices, you will know that one of the challenges is that it's often quite a bit slower for somebody to communicate their needs, or they have a limited amount of vocabulary that they're able to use within their device in order to communicate. So you can then consider how challenging that might be to use in a legal proceeding, and the need for support. So it's imperative that courts and that all aspects of the legal system allow and promote the use of those technologies to allow for that equal basis with others in terms of their experience. Article 19 is around living independently and being included in the community. And I think this one is maybe a little bit more straightforward. It's a little easier to understand where assistive technology fits in. But this article speaks about the need to recognize the equal right of all persons with disabilities to live in their community with choices equal to others. And those choices include things like the opportunity to choose your place of residence, so who you live with and where you live. There should be no obligation to a specific or certain living environment. And as I'm sure most of you know, that's often not the case. People don't often have choice in where they live. Access to support services should be provided through supportive living or inclusion programs in order to ensure that they're able to live in a community and to prevent isolation from the community if that were to be the case. And the services and facilities that are in the community that they access must be available to them equally, as though they were a person who did not have a disability, and they must be responsive to their needs. So I've put an image here of a person who is using a powered wheelchair. And it's one example of a way that often people do not have access to everything that they need because of their assistive technology, or without their assistive technology, they would not then have access. So you can imagine that living independently and being included in the community, if you were a powered wheelchair user, is obviously your chair is going to make a huge difference as to whether you're able to be independent and whether you're able to have that inclusion. But then again, the community may also have barriers in place that would prevent you from access because of the fact that you were in a powered wheelchair. So it can be a double-edged sword on that sense. I've also included an article here from a colleague who was actually a postdoctoral researcher at the All Institute prior to my arrival, named John Orr, he does a lot of work in intellectual disability, and they are doing research around using assistive technology to enhance community living for people who have intellectual disabilities. And often we forget about assistive technology and intellectual disability, but I think it's really important that this conversation is happening because it's just as important for them as it is for anybody with a physical disability or a sensory disability. So that article is freely available if you are interested in looking for it, and I'm happy to pass on any citations necessary as well. Article 21 is the freedom of expression and opinion and access to information. So this one's been really interesting in the context, and I was laughing today as I was looking at this thinking you can't have a presentation these days without talking about COVID. But this has become really critical in the context of COVID around access to information. So Article 21 talks about publicly accessible information in accessible formats and technologies, as well as the use of sign languages, braille, or augmentative and alternative communication systems. So there has been a series of articles written about the role of assistive technology throughout the COVID-19 pandemic and the roles that certain governments or organizations should be playing in achieving participation of people through and the access to their rights. So in this case, one of the things which is continuously identified in all of the research and has been really interesting over the course of the pandemic is that assistive technology has been absolutely critical for people to learn the information they need to learn about what's happening with the pandemic and to maintain their health and safety. We've also seen a huge growth in the use of closed captioning, as well as the use of sign language interpretation in like public forums. And it's important that that be accessible to people. So using those technologies to allow people to have access to that information is part of those fundamental rights. And it has become ever so apparent in the course of this pandemic. And then finally, I'm going to talk about Article 30, which is participation in cultural life, recreation, and sport. So Article 30 talks about enabling people with disabilities to participate on an equal basis with others in recreational, leisure, or sporting activities. And this came up, I was working with a team last year, or I guess 2 years ago now, that is doing a big project on parasport and how parasport can help to reduce stigma around disability. And we started talking about assistive technology and how assistive technology plays a role in disability. And so my colleague Anna Geppert, who I think is here listening today, and a group of us undertook some research to look at this. So we wanted to really understand how assistive technology was playing a role in sport participation, but not just participation in elite level sport, so not just parasport, but also participation in sport more broadly. So people going to see a sports match at an arena, or watching sports at home, or following sports, or playing recreationally. And we also conceived of sport very broadly. So was going for a walk, we included. Going to play soccer with your friends was included. Being an elite level athlete was included, or skiing, for example. So we were really looking at that broadly. And so what you're seeing in this image is that what we identified is that assistive technology is not only relevant to playing the sport itself, so it's that moment of sport participation, but it's also critical to the preparation for sport. It's critical for post participation in sport, for things like getting rest around a tournament. There are support technologies which are critical to someone being able to play sport. So they may promote someone's wellness, their safety, their access to sporting venues, or prevention of conditions that might prevent them from playing sport. And then these technologies also enabled community and provided a sense of meaning within the community. So it was really telling to us that assistive technology was so much bigger than we expected when we really started digging into the sport piece. And that paper is forthcoming. And I should say too, we we have it up, we have it just now uploaded to a preprint server. And so if anybody does want to see that paper before it is published, we do have access to it for you if you are interested in that link. So I'm gonna start to wind back towards the end now and talk a little bit about how assistive products play this role in things like the Sustainable Development Goals, which are another piece of the puzzle in terms of how we're trying to move forward as a global society. So Emma Tebbett, who is at the WHO, and a number of other colleagues a few years ago produced a document called Assistive Products and the Sustainable Development Goals. So the Sustainable Development Goals are a set of 17 goals that put a focus on inclusion, but specifically for people from marginalized or historically excluded groups. And the goals are from the 2030 Agenda for Sustainable Development. And the aims are things like reduction in poverty, reducing things like food insecurity, ensuring the ability to work, and the ability to participate in education. So these are all just as relevant to persons with disabilities as they are to anybody else. And so when Emma put together this paper looking at the assistive products and the SDGs, she actually looked at all of the 17 Sustainable Development Goals to say, how does assistive technology play a role here? And one that I just thought I'd give you an example of one, because I think it's interesting to see how it, even in places where you don't expect assistive technology to play a role, where it really does. So in the number 15, which is life on land, number 15 is about protecting, restoring, and promoting sustainable use of terrestrial ecosystems. So that's forests, dealing with desertification, land degradation, and biodiversity loss. And when they looked at this conceptually, they determined that assistive technology and assistive products actually enable people with impairments to contribute to this aim. So to contribute to protecting, restoring, and promoting the sustainable use of the environment. And there actually was research that they were able to find where a group of people with disabilities in Malawi who had been given access to wheelchairs were actually able to start a sustainable farming business, grow mushrooms in a greenhouse. They did not require fertilizers or chemicals. They didn't add to the land degradation, and all parts of the process could be done within a wheelchair. So it became a way for persons with disabilities to contribute to the achievement of these goals through the use of assistive technology. And I just thought that was a really interesting example. We've continued to do research in Malawi actually since. It's been a bit of a hotbed of assistive technology research lately. And one of the things that we did was, myself and some colleagues, was we talked to assistive technology stakeholder organizations about how the assistive technology was relevant to their goals, but also how the Sustainable Development Goals were relevant to them. And so the image you're seeing in the bottom with the differently sized circles is showing each of the Sustainable Development Goals, 1 to 17, and the relative importance. So we both how important it was to the organization, the goal itself, but also how important assistive technology was to achieving that goal. And I think what I want you to take away from this image is that none of the goals were ignored. All of them were relevant in some way to the organization, and all of them felt that assistive technology could help them to achieve those goals in some way or another. So I think we can't talk about rights without talking about access to assistive technology. And the World Health Organization estimates that more than 1 billion people in the world currently need access to assistive technology. And that includes 970 million people who need glasses or low vision aids, 75 million they estimate who need wheelchairs, another 150 million who need other mobility aids. But the estimate is that only 1 in 10 people actually has access to the products that they need. Lots of reasons for that, but in lots of cases, it's the high cost of products, lack of policy, or a lack of a skilled workforce to deliver. But the estimate is by 2030, which isn't that far away, that more than 2 billion people in the world will probably need access to assistive technology because of demographic trends. So in response to that, the World Health Assembly in 2018 made a resolution, World Health Assembly Resolution 71.8, around improving access to assistive technology. And they called on national governments to develop assistive technology policies and assistive product priority lists in order to promote access to those technologies. They also asked for the WHO to produce a world report on assistive technology, or a global report on assistive technology, which would highlight the current state of assistive technology provision on a global level. So that is in progress and is due to be released in 2022, but so this year in April. But in the meantime, all these background papers were commissioned by WHO, and they were produced primarily by UNICEF and Assistive Technology 2030. And so on December 24th, so just a few weeks ago, we actually published a collection of all of those background papers. It's fully open access and available in the Assistive Technology Journal. And so there's an introduction, which I've screenshotted here, as well as 11 papers that form the background to the World Report on Assistive Technology, or the Global Report. So if you're interested in those, I'm happy to send a link, or you can find it on the Assistive Technology Journal webpage. And I also wanted to briefly mention We the 15. This is a program that has come out of the Paralympic movement, but it's including a huge number of organizations who are trying to increase visibility of persons with disabilities through sport. And they're wanting to acknowledge that persons with disabilities make up 15% of the population, hence the hashtag. And one of their pillars is actually assistive technology. So there is growing recognition of the importance of assistive technology in actually achieving these rights. When it comes to Canada, there's actually been quite a bit of research that's relevant here. So I've put a few of them on the screen here. So we have done some research, and Ed Giesbrecht, who did the lovely introduction today, was part of this research with us, where we looked at the Canadian Survey on Disability and things like unmet needs around things like mobility devices, home modifications, and personal assistance. We've also done some research looking at the policies governing funding for wheelchairs and scooters, showing that in Canada, there is, as you know, incredibly disparate policy and therefore completely inequitable access depending on the province that you're in. We also looked at the Canadian Survey on Disability as well, around assistive technology use and unmet needs more broadly outside of just mobility devices. And then colleagues from the University of Toronto and McMaster, as well as a few other organizations, have looked at equity around access and funding for assistive technology quite broadly. So all of those articles are available if you're interested. And I think what you get as a collective from this research is that there currently is no just access to assistive technology. There are significant unmet needs still in Canada. The data from 2012, it has since been updated, but it hasn't yet been comprehensively published. But even our 2012 data suggested that nearly 15% of the population used some form of assistive technology, and nearly 1% of the population had an unmet hearing or unmet need for hearing aids alone. So you can imagine the remainder of the technologies as well. Just a note, considering Canada's Indigenous population particularly, this is an area where there hasn't been a lot of research, but a PhD candidate named Natasha Alton at the University of Toronto, who's a researcher with the HWL network, has done some work on this, looking at the background to challenges faced by Indigenous people in Canada around accessing AT. She talks about things like high cost of living, challenging physical environments, particularly for those living in northern communities or communities where you have a lot of snow, limited accessible infrastructure, limited access to health and financial resources, that kind of thing. So there is that additive nature, or that intersectional nature, of being a person with a disability and also belonging to an Indigenous community that may actually make it even more difficult for people to get access to assistive technologies. And with that in mind, and with the knowledge that Canada only ratified the UN Declaration on the Rights of Indigenous People last year, I wanted to bring up this idea around systems thinking around assistive technology. So my supervisor, Matt McLaughlin, and Marcia Shearer did a paper in 2018 talking about systems thinking. So they took those 5 Ps from the GATE initiative and they expanded them, talked about there being other contextual factors that were important. It wasn't just these 5, there were other contextual factors. And so those included things like pace, like how fast are you actually going to make these things happen? What partnerships are necessary? What is the role of place in somebody's experience? But one of the arguments that has been made since, and the argument that Mac will talk about at length, is that there's a P missing, and the P is around power. So we really need to consider, when we're thinking about access to AT and therefore access to rights, that power should be included amongst these. So who holds and yields the power matters. It's a very important consideration when we discuss the relationship between assistive technology and rights, and it becomes even more important when people are a part of other marginalized or excluded groups in addition to having a disability. So my big message of the day is that if a person is unable to realize those fundamental rights without assistive technology, then that means that denial of the assistive technology is therefore a violation of their human rights, and we need to treat it as such. And we need to be advocates for them in that respect. And then back to my take-home messages that I started with, persons with disabilities, as I've described, have the same rights as people who currently do not have disabilities. In our society, we have agreed on those rights, and it is therefore our responsibility to ensure those rights are realized. And finally, that assistive technology is critical to the realization of those rights. Thank you very much. And then we have a little bit of time for questions. And I'm going to toss it back to Ed, who I think is going to moderate this component.
Great. Thank you so much, Emma, for that presentation and for bringing us here. Just a quick note here that we are encouraging you to click on this link and complete our very short survey to give us some feedback around these Illuminate presentations themselves. So as Emma has identified, we're going to open it up for questions now. And I would suggest that people can unmute themselves and ask a question directly, or if you'd prefer that I ask the question, you can put it in the chat and I can pose it to Emma. So Michaela's got her hand up. Go ahead, Michaela.
Hi, I figured raising my hand was probably the easiest way to do that, but the organization that I work for is actively looking at increasing the accessibility of our programs, but as someone who doesn't have a disability, it's difficult to tell what exactly it is that we need to improve or change, recognizing that there's a disproportionate burden on people within a community to advocate for themselves. Do you have any advice for like where to go to find service or something to help to evaluate those needs?
I think you have an excellent resource in terms of the university and occupational therapy program. I think there are organizations that are organizations of persons with disabilities for whom that role is to represent and support those individuals. So rather than always going to individuals themselves, going to those organizations for whom it is their job, right, to provide that input, partnering with them. There are independent living organizations and others who might be able to provide you with some of that feedback. But really, at the end of the day, it is going to be, I think, from my opinion, about listening to your service users and what they need in order to ensure that they're able to access your services.
We do have a question in the chat, so maybe I'll just pose that there. It comes from Cade. How do you define participation, and have you found you've needed to differentiate between positive participation principles and harmful practices?
I'm hoping you can clarify a little bit by what you mean by harmful practices.
Okay, are you able to jump in either in the text or?
Hi, can you hear me?
Yes, yeah.
Okay, by harmful practice, I guess I mean when we look at a lot of public school, for example, physical education, a lot of the curriculum really focuses on we really just want the student to be in the same space, and they don't really consider putting a student in the same space as everybody else can actually be dangerous, can be harmful, can increase any kind of disability related stigma, and even inappropriately including them can actually alienate them even further. I was wondering if you came across the need to address that in your research.
Thanks, Kate. That's a really great question. I think this idea of participation, from my perspective, needs to be based on the individual's desired participation and the ways that the individual wants to engage with and participate in their communities. I think it can be very harmful for that perspective to come from the outside, for somebody to say this is what participation looks like for everybody, or to be too universal in terms of defining what participation looks like, because I think it has to be individual. So I definitely think you make a really good point that in some cases, having somebody participate for the sake of participation is not necessarily in their best interests at all times. And that it is really important that it be defined by the person. And that's why I like that the GATE initiative, when they talk about assistive technology, they very consciously put the person in the center, because that is the person who uses the technology, who participates in the activity. They're the one who needs to be central to those decisions. And others can support those decisions, but it really needs to be participation in the way that the individual wants to and wishes to participate in their society.
Wonderful, thank you.
Thanks, Kate.
Excellent question. I agree. We've got another question in the chat from Mubin. Thanks for a great talk. In Canada, I personally struggle the most with delays relating to home modifications required for persons with disabilities, especially those requiring assisted mobility devices, lifts, etc. Arrangements of those often takes months before a person is able to be relocated back into their home. What is being done to improve this on a larger scale globally and in Canada specifically?
So I have a probably unsatisfactory answer for you. The answer is that on a global level, the concept which is used, and there is lots of debate around this concept, is the term used is progressive realization of rights. So the global community has identified and acknowledged that while we've agreed that these rights are all critical, that not everybody has access to them today, and not everybody will have access to them in an immediate sense, because it is challenging in some cases to put the conditions in place for people to have access to them. So they've introduced this concept of progressive realization, meaning we're getting there, like we're working towards it. Obviously, for somebody for whom it's like a today need, that's not satisfactory, right? That doesn't meet your need on a day-to-day basis. There is no real global movement around particular aspects of accessibility like this. The global movement is broader, just around assistive technology in general, which would include assistive technology. And the goal around the global work is to build policies which will ensure that people have access to this on a national level. But then it really comes down to the national governments and the responsibility of the national governments to make that actually happen. Canada is particularly challenging given the federated nature and the fact that it's provinces within a federal structure. And so the provinces actually then have the responsibility for this. And furthermore, there may be national programs, but then the implementation still happens on a provincial level. So like I said, this is it's not a great answer in terms of giving you a sense of something like concrete being done, but I think there is a general movement to improved access to services, and that would include home modification and accessibility services. It just unfortunately is not moving at the speed at which it should, and that takes sustained advocacy, and it takes sustained advocacy from people who continue to remind their governments that they have a legal obligation to the rights that are enshrined in law.
Yeah, no, thank you so much for that answer, because that disturbs me, because looking after acute care and chronic care patients, you're transferring them and yet they're occupying a bed in each of those places. and you are a huge cost to the system. And if we move fast and do things faster, maybe that cost can be saved instead, rather than being that long a stay in a long-term care facility where somebody else need a bed there.
Yeah, so as a follow-up to that, I will tell you that there is substantial research happening around cost-benefit analysis of the provision of assistive technology. And so that often governments don't respond to things unless they're told how much less it's going to cost if they do it right. And unfortunately, they're not necessarily always swayed by the it's the right thing to do argument, right? But there is a substantial amount of research currently ongoing around cost-benefit to providing assistive technology. A lot of it's coming out of the Assistive Technology 2030 program. And they're actually saying now that they think over a lifespan that it's a 9-to-1 ratio of cost of assistive technology versus the cost of not providing it. So there are some numbers starting to emerge, and those are going to be really useful from an advocacy perspective.
That's interesting.
Yeah, I can find that as well. If you'd like to be shared, just feel free to email me.
Thank you so much.
Okay, we've got C. Lafreniere with a hand up. Do you want to go ahead?
Hi there, my name is Serena, and I can totally understand what Rafi is talking about because I'm from Canada too, and I've helped, a lot of people, elderlies and whatever, and I know how hard it is to get your assistance in the home. It takes a long time. For an example, my dad came to live with me, and it took like almost 3 months for somebody to come in and whatever, get the help I needed. But on the other hand, I know it can be done because I went to England. My brother-in-law was diagnosed with cancer, and it hit him really fast, and he didn't have much time to live. So after they did whatever they could, they asked him, they said in the hospital, they said, "I'm so sorry, we can't do anything more from you. Would you like to convalesce in the hospital, or would you like to go home?" And he said he wanted to go home. Now, this conversation happened on a Wednesday, and my brother-in-law was home on Friday afternoon. Everything was in place with a bed, with the nurses, with the schedule, with the medication. I was blown away. And that's what came to my mind. Why can't Canada, or why can't our places do something like that? Because you think about all the money, like you say, they would say from the hospital, the families are willing to help. Like in my instance, I wanted my dad to stay home. I wanted home care, but I couldn't get it for another 3 months. I couldn't take the chance to keep him home alone because I had to go to work. So I had to put him in a place to live. But if we had something like that, what happened in England, I was blown away. So I had to mention that it is possible. Some countries know what they're doing. I hope we get there soon.
Thanks, Serena. I think too, and this is where Canada's complicated as well because it's federated. Some provinces have faster access to some things than others. And so it's not even just unique to Canada. It is very much jurisdictional based on the province. So like if that same thing were to have happened in Ontario in terms of needing to go home because they have a program called Home First, which is specifically dedicated to it, you would have had that access to that care in the home in a much quicker way. So it's frustrating. I agree. And I know I have said this a couple times. It unfortunately does not change without sustained advocacy and without really clear data and evidence as to why it's critical that those services be provided. We know it is. I mean, those of us who have worked clinically know it is. We experience it every day. Those of us who have had family who have needed care, we know how critical it is. But it's getting it into policy can be challenging.
So Emma, thanks very much. I'm going to do the very uncomfortable and unpopular thing of pulling this to a close because I'm looking at the clock and realizing that we're just short of 1 o'clock. But I want to thank you so much for an excellent presentation. I had my whole list of questions, but I wasn't going to sabotage other people's opportunity. Thank you so much. That was an interesting presentation. I did include Emma's email in the chat, so if you want to connect with her directly, you can use that, or you can reach out to us here at the College of Rehab Sciences and we can pass on that information. But again, thank you to Emma and for all of you who joined us today for an excellent presentation, and we look forward to the next Illuminate.
Yeah, thanks. It was a pleasure.